Welcome everyone who's tuning in today, to our viewers out there. My name's Dave Boyle. I've been in the occupational healthcare industry for over 15 years now, and I'm thrilled to have the opportunity to discuss Occ Health in general, where it's going, the innovation, where it's come from, and a whole world of great insights with Dean Mohr, the founder of Body Care, an innovator in the industry, and a founder of My Occ Health Record, something which has just hit the market. We're really keen to unpack today what it includes, what it can do, and how it can help the industry as a whole. So welcome, Dean. Great to be here with you today. Really excited for the chat. Thanks for the invite. Thanks for the T-shirt. Yep. Very nice.
I got told we had to wear these T-shirts, by the way. It's a marketing thing.
Well, there's no such thing as a free T-shirt I hear out there.
Yep.
So today we'll be talking about occupational healthcare, how it's being reinvented, how it's changing the marketplace. There's a whole lot to unpack. And I guess, Dean, it's been more than 20 years of you in the industry and you're still here. What keeps you in the industry?
Love health. I just think it's a sector that makes a difference to the world. I think it gives you a reason to wake up in the morning. You're changing lives. I think it's space for innovation. I've been lucky enough to work with some incredible people over the last 20 years. My business partners, Matt and Rod, we've just gone on this big journey together, and I just think that at the end of the day, it's a space where you can feel good at the end of the day when you go home.
I couldn't agree more. If you work in healthcare, you're passionate about looking after people, the health and wellness of individuals. I think it's a hot topic today. The well-being, the healthiness, the mindfulness, the psychology, the injuries, they all play a part in making sure that, the world continues to tick over.
Yeah, it's a hell of a lot of fun, that's what I'll tell you. And I think we're in this really interesting moment right now in time where technology is really starting to step in and play a huge part in what the future of human health looks like.
You've been in this industry for a very long time, so where did it all begin?
It began 2001. I'll try and cut a long story short, but in essence, I got my first job in Hoppers Crossing as a new grad for a gentleman, for a clinical group called Body Care, owned by a gentleman at that time called Dave Sagar and a partner called Simon Bogue. And for those of you that are in the occupational health industry, you'll know Dave Sagar has gone on to do some incredible things in occupational health, building up IPAR, and then growing it, and then ultimately that became a part of the Med Health Group, which today is a very large occupational health business across this country, or health business. I really found as a young physio that the workers' compensation system didn't work. I found it really challenging treating people who were on workers' comp. I didn't think they were being really taken care of in a system that was meant to take care of them. And I was taught as a young physio, to be honest, not by Dave Sagar, but by other practitioners around the place, that to fill your books up. And if people feel better, then you're doing a good job, but that doesn't mean they're going to get the right outcome. So I found a niche in the market with Kraft Foods in Port Melbourne. They were sending me a lot of patients to Port Melbourne, our clinic, and I went back to them and said, hey guys, I think we can do this better. I think instead of people turning up to my clinic, what if I come on site? I'll be here for 4 hours a week. We'll enable people to come and see us day one when they've got a musculoskeletal injury, not 8 weeks after they tell you they've got that problem. It doesn't matter how they've done it. Surfing on Sunday or picking a box on Monday, it's going to be your problem. And what if we can get on top of these things really early and then mitigate their risk of becoming a long-term injury for them, which impacts them and their family, and a cost and burden ultimately to you when you're trying to operate a business. We realised that we were getting people in the door really quickly. So a neck injury, which might have taken 8 weeks prior to that, you wait time, you put in a claim, you go to your physio, it might take 8 weeks, might take 12 weeks, all of a sudden was taking 4 days because they were coming in today when they had a niggle, even if it was slight, and we could deal with it straight away. And so the employee was winning. They weren't going home with long-term injuries that were causing big problems. The employer was winning because the employer was mitigating the issues that were created with having a workforce that potentially couldn't be on site, couldn't be working, managing injuries. It's a complex thing to manage human injuries. And we really made a conscious decision that we were going to be the organisation that was focused on injury prevention, and that was everything until the point of injury. Pre-employments, ergonomic assessments, on the floor safety, treatment, whatever it was, anything before an injury, because we love being proactive. That's who we are at Body Care Workplace Solutions. And we love using data, which we've learned to do, in a way that no one else can, to mitigate and prevent injuries in workplaces.
Yeah, wow. It's an impressive story, being a young physio, being part of a wider organization, having an innovative mindset, and seeing that you can change the way that injuries are managed into an injury prevention strategy to not only make it a better experience for the employees who have a niggle, have a sprain, a strain, something early on that should be intervened, rather than waiting to go down that claims management path. I'm really interested. I guess you've got an innovative streak in you. From a young age, you've pushed the agenda of how occupational healthcare can be innovative. It can be more data driven. It can be a better ecosystem.
We haven't been afraid over the years to disrupt our own models to create a better outcome for our clients and the employees that work with them. And we've done that. We've reiterated multiple times through the journey. And so I think what's been pivotal, I sat down with a friend who worked at McKinsey's, and I said to her, like, how do I make this business work? Like, we know it works. How do I prove that it's working to the people in the organization? And she said to me, if you don't implement software that can provide some data and an ROI to the people at the top, who are the CFOs ultimately, you'll never grow this business. And what we started doing was we started recording every bit of data on every single person that we were seeing. So if you imagine, if I walked into a client before we existed as a service on site, and I said, tell me about your injuries for the last year, what they would do is pull out sheets of paper that were incident reports and work cover claims and go, well, these are our injuries. And I go, so tell me then, how do you improve the outcome, or how do you mitigate your risk in your workplace? Oh, well, we had 5 back injuries last year. I said, okay. And so we were seeing people with this on-site physio model early days, day one. You got a niggle, come see us day one. So it's not, I've got a serious problem, but it's actually, what it started to do was enable us to get a full view of the health of the workforce, because any niggle was getting recorded in our system. So we would record who you were, your name, your date of birth, where you worked, the part of the body you had hurt. I mean, standard stuff that the world looks at today. How the incident occurred, when, what time of day, and all of a sudden we were delivering back monthly reports to our clients that started predicting big injuries occurring in their workplace. So we could turn to craft as an example and say, I can tell you, general manager, that on night shift between the hours of 10 and 12 p.m. for the age group of 40 to 55, you've got a greater risk of someone having a serious shoulder injury from jumping off a forklift because they're jumping off while they're still moving. They have no idea about that sort of data.
Absolutely.
So I would say to them, how about we send the physio out on the floor? Just during their time they're on site, we'll create some spaces and we'll get out on the floor. We'll use that data to go and grab that cohort, and we'll be able to talk to them about not being the next person whose life is impacted by a bad injury, and just to be more cautious when they get off a forklift. And why? Companies loved it. And they saw their injuries go, which were going up, drop. And so we've spent years innovating around technology to provide predictive data to our clients. And that software system, which started as a very basic system, got redesigned a few years later, created a dashboard out of it that all of a sudden we were providing insights to our clients. They were live on a dashboard for them. Our clients, being the safety and HR professionals, were using it to report up to their management. And I think that's really important. When you think about clients, you've got to remember that there's someone on the other side of the table. What are they trying to achieve? What's important to them? Not what are we trying to achieve? We understand that very clearly. But what's really important to the HR professional or the safety professional across the table from you? And providing them with data and information that they could share with their senior execs made it really valuable to the relationships we started to build. It was really about providing insights, relationship management, but the data became the core to how we grew this organisation. As a service provider, one of my greatest frustrations was that large multinational corporations every few years go to tender for their service providers. And well, let me lay out an example for you. They'll go to tender for pre-employment medicals. And it's a complicated space delivering a pre-employment medical to an individual and connecting a doctor and a human and timing and everything else around it and getting turnaround times which organisation. It's all very complicated. It used to run on paper. Organisations would go to tender, they'd bring in a partner, they would keep the partner for a period of time. You know this, right? 3 or 4 years, maybe 5 years, maybe longer, but comes the end of that tenure and maybe that provider had software, maybe they didn't. And let's say they did have software. Now think of the amount of data you've been able to capture through that journey of all those employees that have done a pre-employment medical before they've started working in your organisation. And think about the value of that data. Where does it go currently? Where does it go?
I've been privy to that information being in Iron Mountain storage facilities, hard copy boxes,
Right.
locked up, and lucky enough to win an amazing contract and throw on the keys to a storage facility. Work it out. It's your problem now.
Mm-hmm.
And so I couldn't agree more. It's a nightmare to deal with out there, and without the data, how do you make these key decisions around how to manage your workforce?
Exactly. So we've got this data. It doesn't get used by the organisation. Organisations are doing pre-employment medicals, and this is just one example of it. Ultimately, what for? To reduce the risk of injuring that employee when they come in to do the job. So you've hired them, you've got the data on them. Why don't you use that data meaningfully? Why don't you capture that data, hand it over to the safety people, the health and wellbeing people, the injury management people, so that you can start understanding, well, we hired 100 people last month. Actually, there were 14 of them that had a slight shoulder niggle that actually was consistent amongst 14 of them. What if we could do something with that data and go and mitigate the risk of those people having a long-term claim that costs our company a fortune in money and actually have a positive, proactive impact on having a healthier workforce? What if we could? No one did it.
No one did it.
No one does it. It's crazy, right?
And I think to that point, that's why the industry bodies and regulators exist. For when technology wasn't available, a pre-employment medical sat in a paper copy somewhere in a top drawer or a filing cabinet, and organisations just did the bare bones minimum that they were required to do. I think a lot of industry bodies, regulators came in and said, you need to do more. We need checkpoints throughout that employment. And I guess that's exactly what you're trying to achieve here is,
Absolutely.
a proactive way to approach and manage your employees without having a regulator breathing down your neck.
Totally. And so what we did was we took our software that we'd been delivering to clients for 20 years, who loved a dashboard and who loved to be able to understand what was happening with the data across their workforce and how to implement strategies that were going to mitigate risk. And we took this and we said, it's crazy that organizations don't have this for themselves. It's crazy that they do all this testing. We might be, as a service business, one provider that does one service, but organizations, multinationals, they're doing drug testing, they're doing periodic testing, they're doing pre-employments, they've got on-site services of different sorts, they've got occupational hygiene they've got to manage, a lot of health data. And it's everywhere. It's on different laptop hearing tests that are done annually across different sites. Different providers provide it. It's everywhere, the information. And it looked to us like it was a lot of tick and flick. But in reality, what they're all trying to achieve is a healthier workforce. Why? Healthier workforce, happier people, but also to reduce claims and costs. They're still commercial businesses. So they've got to use the data. They do it in other parts of their business. Why not use it around human health? So we looked at our existing system and said, we need to flip this model a little bit, and we need to give employers or industry bodies the ability to have oversight over the data. Let them have all the data sitting in one place. Let them have the capability to provide governance so that a health assessment done in one facility is exactly the same as a health assessment done in another facility. Or we're doing drug testing in one state, let's bring it all into one place. And drug testing in another state, let's bring it all into the same place. we can start building profiles. So hence, we had this big session over a couple of days with our old system, and we came out of it and said, we think we've got something here.
Tell us a little bit more about my occupational health record, my OC health record. What is my OC health record, and how is this bringing innovation to the industry?
But the reality is it's about having a health record for an individual that sits in one place, that has layers of governance, that enables organisations to get a longitudinal view over their workforce, cohorts of their workforce, to actually be able to use the data in a meaningful way to mitigate risk. And it is the one problem that for years bothered me in providing services into these organisations, because ultimately, if we're trying to create healthier workplaces, humans that don't get injured, and we want to lower our premium costs, which are rising by the year, let's do something that makes a difference. Not just roll out another manual handling training next year. Let's actually understand the problems. That's what other sectors have done around the world, and they've done it well. HR platforms came out years ago. They said, let's bring platforms together. Let's have an HR platform, bring all the data into one place to help manage the human. Now we need to manage their health, because especially in blue collar, that is pivotal. I always said that in blue collar roles, in organisations where you need to use your body day in, day out physically, your resume is your body. That's really what it is. You've got a skill set. It's important. There's no question about that. But they're looking for individuals who can help them deliver hard manual work, organisations. And so how do we protect them? How do we enable them to do their job and prevent them from getting hurt and lowering our costs? I always come back to it. And so we created this system to do that. So my OC Health Record today, as we look at it, is an enterprise platform. We've spent 5 years building this, barely gone to market. And we're going to hold off going to market until we've got a product that is a market fit. And what we're now seeing across different sectors, mining, government, manufacturing, is they've got this need for it. And it's filling a gap that they've never had, and providing these safety professionals that I talked to you about, that we spent years building relationships with, providing them with this data that is making their life easier. Their jobs are so difficult without data around them. And so this platform is bringing everything: injury management, pre-employments, health surveillance, anything related to health. It brings into one place, lays governance over it, has professionals, health professionals, employers, employees connected. It is the central source that helps them run and govern what they're trying to achieve in organisations. And I love it.
Yeah.
I'll talk to you about it for anyone.
Look, it's certainly impressive. And in all of my experience, I understand there's a huge amount of complexity in occupational healthcare. You're managing a complex human, and you've got to take care of them in the very best way you can. A lot of organisations out there maybe question about how to do that and to govern a large workforce and provide equity to everyone through that process. I know with such complexity, it becomes really challenging for an organisation to manage their employees. There's so much from recruitment to retirement and everything in between that an employee may need.